Good morning, Manali.
Good morning.
Yeah, please start, Dr. Manali.
Okay. Good morning, everyone. So today's topic is role of physiotherapy in antenatal, intranatal, and postnatal period. So let's start. So what are we going to discuss in today's webinar? So the main highlights of today's webinar would be learning how to contribute as a physiotherapist in antenatal period and in intra and postnatal period by helping a woman giving birth with confidence, helping her to stay fit and healthy, assessing for musculoskeletal dysfunctions and providing rehabilitation with special focus on pelvic health, helping with postpartum recovery. So, what is the role of a physiotherapist during antenatal period? So let's know about it in detail. During antenatal period, a physiotherapist can motivate a woman to remain fit and healthy. It is very important for a pregnant woman to give a special focus on fitness and diet during this period. A lot of changes are taking place in her body. A lot of hormonal changes, a lot of changes in her musculoskeletal system, especially pelvis area. It is being stretched, cardiorespiratory changes. So counseling her about these changes, trimester wise, so that she knows what changes body is undergoing is very important. And regarding the diet, so the calorie intake increases by 300 kilocalories during pregnancy, and she should be counseled about the special requirements which have increased during pregnancy, like calcium intake, folic acid intake, then iron, and also about increased requirement of the protein. Uh, and, During the pregnancy, every woman has different issues. Like some may have issues like low back pain, essential dysfunction. So addressing those special concerns with very specific exercises and not generic exercises. So specific exercises as per as the requirement of the pregnant woman. Then, as physiotherapists, we all are already we know about the various relaxation techniques. Right from our undergraduation level, we have been taught about the various relaxation techniques like progressive relaxation, Jacobson relaxation. So, just familiarizing her with this relaxation technique, telling her the importance of practicing this and how it's going to help her to remain calm during this period. And this also can be, a very important tool during labor. The different breathing exercises, as we all know, a lot of changes take place in the body during pregnancy, especially the diaphragm is pushed up, right, because of the growing fetus, and space by the lung which is occupied is reduced now. So special focus on the breathing exercises, especially diaphragmatic breathing, which can be started as early as first trimester. Then the apical breathing, lateral breathing, teaching her the importance of breathing exercises. There will be increased oxygen supply to the growing fetus, to the various organs. She's going to feel more calm and relaxed. A lot of problems like breathlessness, it's going to help her in all such problems. So teaching her the deep breathing exercising during antenatal period. So knowing further about the fitness and exercises, going further, what is exercise? Exercise is defined as a physical activity consisting of a planned, structured, and a repetitive body movement. It's done to improve one or more component of physical fitness, right? And it's an essential element of a healthy lifestyle and should be encouraged as a physiotherapist by us. And it now is ACOG guidelines, the latest ACOG guidelines states that women who have been engaged in vigorous or moderate intensity of exercise before conceiving can continue to do those exercises even after pregnancy. So what we should remember here is pregnancy is an excellent time for behavioral modification. It's a good time to have good habits because you are motivated to do something good not only for you but for your baby, right? But we should always remember here we should never ever push ourselves during pregnancy. It's not the time to start something new out of blues, not to start rigorous activities if you have never done it in your life. No. So you have to listen to your body, go slow, and gradually step up. That is the key during pregnancy, and yeah, right. And even during postpartum, you can gradually step up your exercises and get back to the fitness level which you enjoyed previously, right? So, what are the type of exercises that can be encouraged during the antenatal period? So, exercises like walking, stationary cycling, aerobic exercises, dancing, resistance exercises, but with caution, um, and not here. The what should be stressed upon is not to hold the breath for too long. If even if you're doing any kind of resistance exercises, this needs to be focused on specially because a lot of women, when they do resistive exercises, they tend to hold their breath, which is not at all recommended in pregnancy. So special focus on breathing during exercise has to be emphasized. Okay. Now stretching exercise. Here the point which has to be kept in the mind is there's a hormone called as relaxin, which increases especially in pregnancy, especially in the third trimester. So the pregnant woman should be counseled that she should not be overstretching her joints. She should not be pushing herself. Stretch till the time it's comfortable, and then slowly you go further, because there is chance of injuring yourself overstretching during pregnancy. Okay, so yeah, hydrotherapy and water aerobics, like they have immense benefit if done during pregnancy. Apart from giving all the fitness benefit, it also promotes relaxation, right? So these are the type of exercises which a pregnant woman can do during antenatal period. Going further, so care during exercises. So what kind of exercises are you going to encourage, and what care is recommended that the pregnant woman, what precautions are recommended? So we would recommend aerobic exercises as compared to the anaerobic exercises, okay? Because aerobic exercises require because the woman would be more comfortable performing aerobic exercises because of the increased requirement of the anaerobic exercises. So compared to anaerobic exercises, it's recommended that women does aerobic exercises. Then there has to be one thing woman has to keep in mind. She has to not overexert herself. Okay, the core temperature should not exceed the body should not excessively get heated up. So that has to be kept in the mind. And how does she ensure this? She ensures this by having proper hydration. Okay, that's something very important. And a lot of women miss out on this. So it is very important that you encourage her and counsel her on having proper hydration during pregnancy and especially when she's exercising. So then also the kind of clothes she's wearing is very important. We encourage loose fitting cotton clothes preferably because if there is a restriction in the clothes, then there would be hindrance in the blood supply, okay, which is very important and can't be compromised during this time. Then how does she know how much to do? Most of the women ask us how many repetitions, kitna karna hai. So during pregnancy, what you have to remember, you have to be able to talk while exercising. When you talk, you should not be gasping for air. That's like called talk test. Okay. So if you are gasping for breath when you're exercising, then you're pushing yourself too hard. So that's not done. You should not be doing that during pregnancy. Then avoid lying flat on the back for a long time. So why this? Because it reduces the venous return, right? Because of the compression of the inferior vena cava when you are lying flat on your back. So especially after 20th week, we wouldn't encourage pregnant women to lie flat on her back for a long time during exercises. So this should be discouraged after 20th week, right? And she should be encouraged to change positions during exercises. That will be more comfortable for her. So yeah, so going further. So yeah, exercise is the way. What are the advantages? So many advantages. And how much exercise? What is the duration which is recommended by the SUG guidelines? So guidelines recommend 115 minutes of moderate intensity aerobic activity per week during pregnancy and postpartum. That comes up to around 20 to 30 minutes of exercise every day, or at least 4 to 6 times a week. Okay, that is recommended. So why exercise during pregnancy? What is the benefit? So it lowers the incidence of excessive weight gain. It's such a big problem, maternal obesity, which can give rise to so many problems, during the antenatal period, like gestational diabetes, gestational hypertensive disorders, preterm birth. Now it was thought like women used to not exercise because of fear of preterm birth, but on the contrary, if you're active, if you're exercising, if you're fit, your chances of preterm birth are reduced. Okay, then also it reduces the incidence of C-section, the need of C-section, because you're fit, your pelvis is more flexible, you're in a better health condition, so it reduces your chances of having a cesarean section. uh, Chances of having low birth weight are reduced, and also of the baby, and chances of postpartum depression, which is such a big thing, is less if you are exercising regularly during pregnancy and postpartum. So, yeah, going further. But certainly, there are some conditions where you need to stop exercising for some time, maybe sometimes, and start exercising maybe after consultation with a specialist. Okay, so what are those conditions? Yeah, first is vaginal bleeding. So, if you're experiencing any kind of vaginal bleeding, it's a good idea to stop exercising. Consult your healthcare provider before going ahead with any kind of exercise. Okay, then sudden abdominal pain. So it's all again better to consult your healthcare provider before continuing your exercises. A regular painful contraction, supposing you're contractions and they are progressing the contractions. So you need again to consult and stop exercising. Okay. Then amniotic fluid leakage. If you are experiencing amniotic fluid leakage, it's a good idea to stop exercising and you feel breathless, you're not doing any activity, still you feel breathless, then it's a good idea to stop exercising, right? Then dizziness, if you feel dizzy, headache, chest pain, muscle imbalance, muscle weakness, if you're experiencing muscle weakness which is affecting your balance, which is making you more likely to fall, so it's a good idea to stop exercising. Any kind of calf pain or swelling, so it's are the various contraindications which if you experience during exercises, you should stop exercising. Of course, there are various medical contraindications also to exercising. Okay, like placenta previa. Okay, so in which cases you should not be exercising. You won't be recommended to exercise. Yeah, so this is about antenatal physiotherapy, and now going further to intranatal physiotherapy. What is intrapartum or intranatal physiotherapy? So, exercises, if done during labor, helps in progression of labor. It helps in making the labor more comfortable for the laboring women, because we all know biomechanics of pelvis. We know that if the pelvis is flexible, okay, it will help in optimal baby positioning. It will help in baby to put the position in a better position, which increases the chances of having a normal delivery. Also, yeah, so I will discuss about the various birthing position in the subsequent slides. So, the importance of breathing exercises which you have learned during the antenatal period are going to be so valuable during the labor. It's a very important tool which you can provide the laboring mother to help her to manage her labor pain. So, what are the different breathing techniques which a laboring woman can do during labor? One of it is deep breathing exercises, diaphragmatic the antenatal period. You can also teach these exercises to a partner, because during labor, many women may not be able to, remember all those techniques at times. So if her partner is present with her in the labor room as she labors, he can encourage her, support her, and do the breathing exercises along with her to encourage her to, do the breathing exercises. Then the other kind of pulse lip breathing is very helpful during active labor to manage her labor pains. Then again, practice of progressive relaxation, which she has been doing in antenatal period can be practiced as she is having a labor contractions. Just encouraging her to relax the tense muscles, because her entire body is connected. When most of the time we respond to pain by clenching our body, by clenching our jaw muscles, clenching our pelvic floor, which only which we perceive the pain um, in a much larger way than it is actually is. So just learning to relax your muscles is going to contribute in a very helpful way to perceive the pain as less than what it is. So yeah, relaxation exercises have extremely crucial role during labor, and as a physiotherapist, you can encourage her to do it. Going further, so we have already spoken about the pelvic girdle. This is the pelvic girdle, and you can start doing the exercises in the antenatal period to maintain the flexibility of the pelvic girdle. Various exercises like lunges, tilting exercises, cat and camel exercises can be practiced during the antenatal period. Then going further, these are the different birthing positions, right, which women can adopt as the labor goes on during the intranatal period. As you can see, she can be walking, forward leaning position, cat and camel position. Then during the transitional or the birthing second stage of labor, she can adopt squatting position. So so each position has its own unique advantage. So, like to give you an example, cat and camel position or all four position. If the woman is experiencing back pain, okay, then you can encourage her to go in cat and camel position during the labor. So, what will be the advantage? It will offload the back from the weight of the fetus. It will be more free, to move. So that can be, it will help her to manage pain again. So positioning plays a very important role. Then squatting position, as we all know, when the woman squats, supported squatting, it helps in opening the pelvic outlet, which is so important during the birth of the baby, right? The the wider the pelvic outlet, the better the opening of the pelvic outlet, easier, less pain, and the time required also reduces, for the delivery. So you can help her going into this position. Then soft tissue mobilization, massage techniques. Various massage techniques can be given during the time of labor. It helps her to manage her pain. Her partner can also be taught this massage techniques. Okay. So yeah, going further, so as I explained about the cat and camel position, so as you can see in this uh, slide, she's she's in the all four position. Sorry, she's with the help. She is doing anterior and posterior pelvic tilts. Okay, and her body is completely relaxed. Her entire weight is on the ball. That is helping her to keep the pelvis relaxed, and she's practicing anterior posterior pelvic tilts in this position. Okay, this is antenatal preparation, but these exercises can be done during the labor itself, right? Okay, so going further, then coming to the postnatal physiotherapy. So, what is the role of a physiotherapist in the postnatal period? So, your role is not only limited to antenatal and intranatal, it extends in the postnatal period also. So, fitness and weight. Yeah. So, as you know, the women will put on weight during pregnancy, and it is expected of her because of the growing weight, because of her. And so, during the postpartum period, so you can help her with regaining her fitness back with the weight loss. So, when does she start exercising after the delivery? So she can start exercising after delivery after 4 to 6 weeks with the proper exercise regime. But with the exercises like Kegels, shoulder blade exercises, shoulder mobility neck exercises, she can start exercising even on day 2, 3, or 4 after after having a normal delivery, even after C-section. As when she feels she can sit, can upright, she can start with her Kegels exercises and shoulder blade exercises. This is going to help her immensely in feeling good, remaining fit, because soon after birth, lactation starts, breastfeeding starts, right? And breastfeeding is something which is going to happen round the clock after every 2 to 3 hours. So she needs to have a good posture for that. So if she's doing shoulder exercises, she's doing stretches, it's going to really help her with that. If she's not having a good posture while breastfeeding, it's going to reflex. She's going to start having back pain, neck pain, and that's going to cause a lot of problems, not only from pain perspective, but even she may have feeding problems because of improper posture. So, uh, so she can start proper exercises by after 6 weeks, but mild exercise like Kegels, shoulder exercises can be started as soon as she feels fit enough, maybe after 2 to 3 days also, right? Then the dietary habits again, having the importance of having good diet, importance of having good fiber intake, fruits, vegetables, increased protein intake should be continued, in postpartum period also, as she was following, because she is lactating, she is breastfeeding. So she needs to have a especially good protein intake. That is something very important which should be stressed upon. As I've already discussed, posture during lactation. So you can help her with teaching her different positions during lactation, and what is the ideal posture that she should be keeping her shoulders back and straight, and not sitting in a slouch position, for a long period of time. And maybe she can keep her foot rest under her feet as she feeds, and keep a small pillow behind her back when she's sitting and feeding her baby, because because one feeding session may take 10 minutes, half an hour, and it'll be repeated after every 2 to 3 hours. So it's very important that she has a good posture when she is feeding. Then there are various musculoskeletal issues, right, which a woman can experience after in the postpartum period. So what are those various musculoskeletal issues? So one of them is diastasis recti, and diastasis recti is extremely common. Every 1 out of 2 women experiences it, during pregnancy, and it does sometimes continue for a long time in the postpartum period. So after 6 weeks, so you should give your body time before you start any rehabilitation. Okay, so she should be encouraged to give her body time to see if it goes back on its own. At least 6 weeks should be given to her, and if it's still persistent, then proper rehabilitation for diastasis recti should be started. Then the other conditions which she may develop and which are not spoken about, and uh, 1 in 800 women has diastasis pubis. Okay, this is a separation of pubis, and it's a very painful condition. So, so treatment for this can be started by giving her stabilization exercises and proper mobility exercises as where it is required. Then a lot of women have low back pain because of improper posture, because of the weight gain, because of excessive loading. So assessing her and not giving her generalized exercises, assessing her and giving her exercises as per her need is very important, especially in the postnatal period. Okay, then incontinence. Incontinence. So many women experience incontinence during pregnancy, and it continues in the postpartum period, and it only gets worse if you don't do anything about it. So what is incontinence? Is she's not able to control. She doesn't have control over the leakage of the urine. When she is laughing or she is coughing, the urine passes, and she's not able to hold on or control the leakage. So, what is the cause of incontinence? The cause of incontinence is the pelvic. One of the major causes of urinary incontinence is pelvic floor weakness. So, as we all know, during pregnancy, the pelvic floor undergoes a lot of there's a lot of load on the pelvic floor. So sometimes the pelvic floor becomes weak, and if it's not exercised, then the woman may develop urinary incontinence, which gets worse as the age progresses. So teaching her the right way of doing Kegels exercises. So there's a lot of misconceptions about Kegels and how it should be done. So many a times the Kegel is not done properly. Instead of contracting the pelvic floor, the woman contracts the adductor or the abdominal muscles excessively or holds her breath. So all as a physiotherapist, you have to ensure that she is practicing the Kegels exercise in a right way. Okay, uh, and it can play a very important part if she does it regularly in the right way during pregnancy and continues it postnatally. So in incontinence, it's very important that you teach her to do the Kegels exercises in the right way. And the postpartum depression. A lot of women are experiencing postpartum depression. Very little is spoken about it. A lot of causes for it. But if she's exercising, if she's having a regular diet, if she's having that social support, if she's counseled properly, the chances of her, managing postpartum depression or going into postpartum depression is less, and the chance of managing is better. So yeah, so even in the postnatal period, I think physiotherapists have a very important role and can contribute in a unique way. Yes, so that's for today. I hope antenatal, intranatal, and postnatal physiotherapy. And yes, thank you so much.
Thank you, Dr. Manali, for this very informative webinar and giving us knowledge about our physiotherapist's role in pregnancy and helping women in general. So thank you, Dr. Manali, for your time and effort. And we wish that you work with us again in future.
Sure. Thank you so much. Thank you for giving me opportunity to share my views on antenatal physiotherapy. Thank you so much.